Tell us about yourself. Who is Jason Wright? where are you from, and your background before you went to tertiary education?
Oh, long, complicated story. I am son of Dr. Paul Wright, known racing personality. He inducted me into horse racing. There are images of me riding racehorses at age 2 that I don't even remember. So as far back as my memory goes, I've been around racehorses. It was just one of those passions that has always stuck with me all throughout, and I found a way to turn my passion into my career, and I've been happy ever since.
School background?
My parents sent me to Hillel for my primary school, and then I went to Campion College before I went to Florida International University in Miami, and then I somehow got twisted up and sent off to the Royal Veterinary College, University of London, to do my doctorate in veterinary medicine.
Is that college close to any known football club?
When we studied in the first 2 years, I had the privilege of living about a half a mile from Highbury Stadium. Go Arsenal.
You were at school at the Royal Vet College. Did you specialize in horse racing?
I didn't specialize in horses per se. The way how the program is set up, in our final 3 years, the clinical years, we have to see a certain number of hours of practice with different vets in different disciplines. What I did was I manipulated the system as best as I could to spend most of my large animal practice shadowing horse vets rather than cows or things like that. Because of where my passion lay, I knew that that was what I was going to pursue post-graduation.
Were you able to go to any of the major tracks in the UK?
I worked with a few vets who I got to practice, got to see practice with them at Royal Ascot. I was studying at Newmarket, so I got to see some practice at Rossdale's and at what is now the Newmarket Equine Hospital. So we were in that area going from one stable yard to the next. It was quite interesting. We spent most of the day just treating animal after animal, averaged about 3 hours of sleep a night over a 2-week window of just seeing different cases and getting my hands dirty. It was really a great experience.
Newmarket?
Newmarket.
Did you ever come across Aidan O'Brien?
I worked with a vet who looked after some of Mr. O'Brien's horses. So there were occasions when I was there and it was really something to behold, especially seeing them going out in the mornings and doing that uphill gallop. It's something about poetry in motion is the only way to describe it.
So that's your background. When did you come back to Jamaica?
I graduated and came home in 2007. I took the local vet board exams in the November of 2007 and I've been practicing since. I had a couple of months, I got some small animal work with what is now Phoenix Vet Clinic. Somewhere around March of 2008, the commission gave me an opportunity to start doing Lasix Administration on race days. And around May of that year, my private practice actually took off by chance, with my first real case on the racetrack being a 2-year-old named Working Image for Mr. Anthony Baba Nunez. He colicked one night on Baba in the wee hours of the morning. Baba couldn't get a vet to come in. His assistant, who is now Donovan Thompson, suggested to Baba, why don't call Jason? Baba was a little apprehensive, having been the new boy on the block. He didn't know if he wanted to take the chance with me, but Donovan insisted the horse was going to die if we didn't get help. So the worst case scenario, Dr. Wright going to kill him a little faster. But at least we're giving him a chance. As it so happened, God was with me that day, that night. We fought, we saved Working Image, and he went on to have a stellar 2-year-old career that year.
Okay. What is the major part of your practice?
No, the major part of my practice is reproductive medicine. I do most of the farms on the islands. So I drive around quite a lot. I do.
You're talking about
ultrasound testing of the mares to see when they're in foal, when they're to be served. I spend a lot of time with the foals doing foal medicine. Every now and again I will have to jump up out of my bed in the wee hours of the morning to help pull a foal out. Thankfully that's not too much of the practice. But the major part is the stud work. I do quite a bit of track work as well, but the bulk of it is on the farms.
So you have been around the farm, the YSs, the Orange Valley,
Orange Valley, Ham, what was
Bombay.
then Mercedes, Bombay,
Right.
Sun Valley, you name it, I've been there.
What's the fall crop like now?
This year we've been blessed. We have not had the mortality rate that we had during the pandemic times, that 20 to 21, 22 kind of era. So we are now better off. I'm expecting us to have a return to the normal number of yearlings that we should have eligible for sale for the 2025 crop. The mortality rate has been in our favor this year. We've been a little bit more proactive and we've saved a lot more this year than we have in the last, I would say, 2 to 3 years. So numbers wise, we're getting back to what we were pre-pandemic.
You're also president of the Jamaica Equine Veterinary Association.
The Jamaica Equine Veterinary Association is a new association which we've put together to give the veterinarians a voice at the table. We saw a lack of anybody speaking for the horses in our industry and thought that we would be the best people to speak on behalf of the horses for the industry that revolves around them.
How many members do you have?
We have about 8 members at the moment. We are open to taking any veterinarian practicing in Jamaica who wishes to join. We predominantly are made up of both the commission vets, the Supreme Ventures vet, and the private practice vets who practice in and around the island.
The decibel level of your association, how high is it?
We're a young organization. We were very flattered and honored to be invited to the recently concluded meeting with the minister. I think this was our first real public outing where our voice was presented. Prior to that, we've had 2 races given to us by Supreme Ventures during World Vet Day, and we're very grateful to them for this. But this was the first time we had a chance to speak up for the horse. There are other ideas we have, and we're just trying to find the most politically correct voice in which to put it forward. I don't always have the most politically correct voice. A bad habit I've inherited from my father. I tend to just speak from the hip and let the chips fall where they may.
Okay. There's a question blowing around Lasix. First of all, what is Lasix?
Lasix, the drug furosemide, which is administered to racehorses in an effort to minimize the effects of EIPH, exercise-induced pulmonary hemorrhage. The rationale behind this is that...
One sec, that's bleeding.
Bleeding, what you know as the horse bled in the race.
Right.
The statistics on it are that if you scope every racehorse on a racetrack, in the Western Hemisphere I should say, you would get about 85% of all horses bleeding to some degree or another. By administering Lasix, we're temporarily dehydrating them and reducing their blood volume, thus reducing the likelihood of a bleed during high levels of stress in the race.
Based on the laws, the racing laws of Jamaica, what is the quantity and the timing factor in giving a horse Lasix before a race?
All right, under our current rule system that we have set out by the Racing Commission, every horse is given 5 milliliters of Lasix and it is administered roughly 4 hours before their post time. We allow, depending on how many horses are in the field, about 4 to 5 minutes of a window in which to get all the horses administered.
Okay.
So that nobody can claim to have an advantage over another horse competing in the same race.
Horses, like humans, have different weights.
I agree completely, and that giving everybody the same dose may not be the best and most effective way to do it. There have been talks between veterinarians, owners, trainers, and there is a movement to have a range being administered to our horses. As far as I know, we have not yet had that rule written into the commission rules, but it was discussed, and a range of 3 to 8 milliliters was what was the guidelines that was agreed upon.
So you're saying that you're looking at 3 to 8 cc's
Cc's of Lasix.
of Lasix. That is dependent on weight, meaning that
All right, so it's dependent on a multitude of factors, because we do find that you will have some big heavy colts who will get 5 cc's and they'll bleed through anyway.
Yeah.
They require a higher dosage. So we'd like to be able to up the dosage for them and give them 8. but we'd have to be able to make that reflected in the race book so that the punter knows how much cc's of Lasix that horse is running on that day, just as a way to stop the manipulation of it by any unscrupulous person in the game. Similarly, we've had small frame fillies, and just using male colts and fillies as the rough guide, that 5 cc's gives them the effect of a washout. When you look at them, you can see these animals are severely dehydrated and they underperform due to 5 cc's being too much of a volume for them at their current needs. And for them, we'd love to be able to cut the dose to about 3 cc's to give them the benefit of some kind of cut of their volume in their bloodstream without having them being washed out and poor performance as a result of taking the Lasix.
In medicine, we know that Lasix can also be used as a masking agent. How does the science reconcile that to make sure there's fair game?
Excellent question. So internationally, what was agreed upon was to use the 4-hour window as the best way to mitigate between using Lasix as a masking agent as well as the efficacy that it has as reducing the blood volume. Lasix on its own has a half-life between 45 and 90 minutes. So at the 4-hour window, it is not as effective as doing its job as we would like. However, it still has an effect. And by pushing it out to the 4 hours, we minimize the masking effect that it can have, again, to just stop the few unscrupulous people who may try to use that as a way to skirt the system. We're trying to minimize that to the best. And 4 hours was what was internationally decided as the best way to get the best of both worlds.
Can you explain in layman's term, what is this masking thing? What do you mean by masking, and how does Lasix mask other things?
In lay terms, without getting too technical in it, because it causes a hypovolemia, it reduces your blood volume by increasing the amount of urine put out. If you were to be as tactical as you wish, you could use Lasix within a smaller time frame, and whatever other drugs you gave the horse, whether it's a painkiller or a performance enhancer, the amount of drug in the horse's system at the time of testing post-race would be minimized. So in an effort to reduce the effectiveness of Lasix hiding other drugs in the horse's system, the 4-hour window was designated.
So will your association be pushing in any other way to get this 3 to 5 to 8 cc's considered?
We will be asking the commission what has happened to the talks that were held on their behalf as to why we still have not reached this agreed upon level. What is the holdup? What is the real reason behind why we can't have a change? Because we have seen now that when the commission wants to change a rule, it's a matter of months to get a rule changed. This agreement to which I'm speaking was something that they spoke to us about unofficially some years back now, and we still are yet to see the rule come into play.
Are you saying then that you need dialogue and you're asking for dialogue?
We're asking for the commission just to let us know what it is. They may have a really good reason behind it. We don't know. Nobody has come back to tell us, yes, doctors, we've understood that. Everybody agrees that a range is going to be best for the horses, but at this time we have X, Y, or Z reason why we cannot implement that at the moment.
What happens internationally in other jurisdictions where Lasix is used?
It's a good question to which I don't have a good answer. I would recommend that question be posed to the Commission Vets, Dr. Ramlal, because of her exposure to other commissions. She would better be able to answer that question than I could, and I wouldn't want to give you false information.
Thank you for watching another video produced by the team from QuickGallopJaya.com and its YouTube channel, The Quick Galloper. Please stay on the channel for other enlightening videos on those involved in local horse racing. Please like, subscribe, and press the notification bell.